partners to make sure that vaccines are available to this community and to look for ways to communicate with them to make them more comfortable with the vaccine as well. One of the bright spots that we've seen here over the last couple of months is the impact that the vaccine seemed to be having in our long-term care facilities. In December, 54% of the deaths from COVID in Mecklenburg County were in our long-term care facilities. And that's been the case since the beginning, where the majority, at least over 50% of the deaths have been in those facilities. In January, that dropped to 30, February to 20%. We're also seeing a reduction in the number of outbreaks in those facilities. So the fact that much of these facilities have people who are vaccinated and staff who are vaccinated gives us a good picture of what we can look forward to as our community gets more vaccinated. That leads me to the new guidance from CMS, and that's not our school CMS, but the federal CMS, on nursing home guidance for visitation. I wanted to speak to that briefly. The new guidance, and again, this comes from CMS. It does not come from CDC. We have not heard from them on this yet, but CMS is who provides oversight at all levels over long-term care facilities and nursing homes in our communities. And what they are, their guidance is allowing for responsible indoor visitation at all times for all residents. There is a recognition and an understanding of the toll that the separation and isolation that this pandemic has created for this population is huge. So effective March 10th, individuals with only some exceptions will be able to visit within these facilities. And all compassionate care visits are supposed to be allowed as well. Everybody's expected to continue to adhere to prevention and public health measures. But if someone is fully vaccinated, that individual can choose to have close contact, which would include a hug with individuals that are coming to visit them, as long as they're continuing to wear a well-fitting mask. So each facility will make arrangements based on their structure and their residents' needs. That may include visitation in residents' rooms, in specific visitation spaces, and in some cases outdoors. That's really good news for our community, and I know that it's something that many people have been waiting for. I also want to announce that this week we are rolling out Count on Me, MECNC, which is a new vaccine awareness campaign. That's coming this week. There will be a link, or there is a link on the county website, the COVID block that you see on that site. If you click on that, that will give you information about where you can get vaccinated, but also lots of other information about the vaccine and its safety and its efficacy. So we ask the community to take full advantage of that site. And lastly, I want to make sure that we continue to focus on those public health measures that we know prevent the spread of the virus in our community. It is critical that while we are getting people vaccinated, we continue to wear our masks, socially distanced, and avoid medium and large groupings in our community. And that leads to my last point, which is we have spring break coming up before too much longer. And everybody knows what happens on spring break. This is spring is coming. Everybody's so glad to be outside, having a good time, and it's an opportunity for people to get together in groups that they don't always are involved with. There's a lot of travel involved in some cases. This is an opportunity for us to, as a community, pull together and one more time asking you to be careful and very thoughtful and smart about your interactions. It is critical that we not see backtracking in our numbers, that we not see our numbers going up because of activity that could happen over spring break. So please be smart, use your common sense. We're not telling people not to celebrate spring break. We know that's an important part of the spring for many people, especially folks with kids. But we're just asking you to be smart and use common sense and stick to those public health measures that we know are going to protect everyone in our community. So with that, I'll turn it over to Dr. Sullivan to talk more about vaccines.
Thank you, Gibbie, and good afternoon, everyone. Again, going to provide a brief update around vaccines for Mecklenburg County Public Health. So as of yesterday, we have administered over 52,000 doses of the COVID vaccine, including over 34,000 first doses. Our immunization team has continued to be extremely busy over the past several days as we work to get vaccine out as quickly and equitably as possible to eligible individuals in groups 1, groups 2, and groups 3, and then plan for group 4. Some highlights from the past several days include events at the CMS bus depot and 2 CMS schools, partnering with Smart Start to have focused events on childcare for childcare providers, setting up weekend clinic to vaccinate a large number of our first responders, law enforcement, and public safety officers, working with our refugee and immigrant communities at the Hindu Center and Galilee Ministries, hosting a large vaccine event in one of our towns, holding our first Johnson & Johnson clinic at our medic location, and partnering with the community clinic to provide vaccine to eligible patients and community members. We continue to work with our community partners and our vaccine event request list to plan future community events aimed to assist with our equitable distribution of vaccine. We also continue to spend significant time conducting outreach to the growing list of enrolled vaccine providers in the community as part of our vaccine equity plan and effort to ensure access to vaccine throughout our entire community. We have been fortunate to have had the opportunity to transfer vaccine to multiple pharmacies and community providers with a particular focus on those who serve populations who have been disproportionately impacted by COVID. And as vaccine supply continues to increase, we are looking forward to further collaboration with this growing number of vaccine providers in the community. And as another part of our overall effort to ensure access to the vaccine for all of our community members, we are also very excited to announce today that we will be making available a vaccine request form specifically for Mecklenburg County residents who are currently homebound due to physical or mental disability and are unable to travel to a COVID vaccine clinic. Beginning today, individuals can now request to receive the COVID-19 vaccine at their home residence by completing a request form that is now available on our COVID-19 website. Residents meeting the eligibility criteria will receive the Johnson & Johnson vaccine as supply becomes available, and each request will be reviewed by Mecklenburg County Public Health and Mecklenburg County Emergency Management and scheduled based on meeting the eligibility criteria, the vaccine supply, and appointment availability. It's an initiative we're really excited about. Finally, I just want to end by briefly talking about the CDC's recently updated interim public health guidance for fully vaccinated individuals. As we have now seen increasing clinical and real-world data about the effectiveness of the vaccines in preventing severe disease and reducing risk of infection and transmission, the CDC has now modified their guidance to allow fully vaccinated individuals to gather with a small number of other fully vaccinated individuals or low-risk unvaccinated individuals indoors without wearing masks or physically distancing. That being said, the guidance still continues to stress the importance of all individuals still adhering to strict public health guidance in public, including masking, social distancing, avoiding gatherings with multiple households or large or medium-sized gatherings, and following CDC's travel guidance. We are very excited that we have a growing supply of 3 safe and effective vaccines in our community and want to continue to encourage everybody to get vaccinated as soon as they are eligible. But in addition to the vaccine, remind everyone that we all have an ongoing part to play in reducing spread in our community through continued adherence to public health precautions.
First question today is Maureen O'Boyle, WBTV. And I believe we're having a microphone issue with Maureen. We'll come back to you. Next question, Brett Jensen, WBT Radio.
Thanks. Because this is the 1-year anniversary of the World Health Organization issuing this a pandemic crisis, and like you said, we're just a few days away from our 1-year anniversary as a state with Governor Cooper shutting things down. It seems maybe like the appropriate time to ask you guys, as we are getting more and more vaccines, as CVS just announced they're going to start doing it, Walgreens is now doing it, when do you think that we will reach that herd immunity, like your best educated guess, either Dr. Sullivan or Gibbie, when we will get to that herd immunity aspect here?
That's a great question. I wish I had a great answer. I think a lot depends on the availability of vaccine and the willingness of our community to take that vaccine. Both of those are issues that are out of our control. But as we get more and more vaccine, and we're hearing from the state that we should be expecting more availability in early April and moving into April and May and then into June, we're being told that anyone who wants a vaccine should be able to access it by June at the latest. So again, then the next step is making sure that we're able to make it available in our community, but then also that people are willing to take it because it's the number of people that are vaccinated that makes the difference. So we are doing everything we can to develop systems for getting the vaccine out as fast as we can. As Dr. Sullivan mentioned, we're working with a number of different partners to make sure they have vaccine available to them. We want this in all reaches of the county. We've had these large events where people have had to come in, but we want the vaccine out where people can access it readily. And then the next step is up to our community and people's willingness to get vaccinated. So if everybody is eligible, if everybody has access by June, my hope is that we'll reach herd immunity by at least June, if not before.
Circling back to Maureen O'Boyle, Megan Comalander, would you ask Maureen's question on her behalf? Thank you.
Hey, Maureen was wondering if people with underlying health conditions have to bring proof of their medical condition to get the shot once they are eligible.
So thank you. I think you're referring to when Group 4 becomes eligible, which will be individuals that have at least one underlying chronic medical condition on a specific list. That will be based on a self-attestation that they have that, and no medical proof will be required.
Next up, we've got Chloe Leshner, WCNC.
Hi, thanks so much for doing this. We are hearing reports that the governor is expected to move up that timeline for Group 4 this afternoon. We know that he's done it before with Group 3. Wondering how the county would be able to manage that, if you would be able to move appointments up or not. Thanks.
Sorry, I was muted. We have already been working on processes and getting ready to open up appointments. And as we have more vaccine, we'll be able to make more appointments available. So I think we are ready for this, as ready as we can be based on the availability of vaccine. We'll continue to work on groups 1, 2, and 3 as we move into 4. So, the availability is key here of the vaccine, but the ability to get it out is that process is already ready to go.
Next question is Mike Stolp, WSOC-TV. Mike Stolp, you're up.
Mike is no longer here. You can go to Paige.
Okay, thank you. Next question is Paige Hopkins, Axios.
Hi, all. Thanks for doing this. I'm hearing stories anecdotally and, just from people who are being able to get vaccinated before they're actually in an eligible group. I'm wondering if that's something you all are concerned about or discouraging, or if it's just the mindset of, the more people get vaccinated, the better, regardless of whether their group is eligible yet.
So we're continuing to work within the guidance from the state and are really focused on those who are most vulnerable and most at risk for exposure, and that's groups 1, 2, and 3. So we're staying focused on that. We are, to a great extent, leaving the attestation of whether they're eligible or not up to the individual. We are not policing that strongly. We don't have the capacity to police that strongly. And so we are asking our community to wait until it's your turn. You're going to have a turn, and it's not going to be that much longer before that happens. That doesn't mean that we don't have some individuals that slip through the cracks and get vaccine and then talk to others about the fact that they got vaccine, even though they weren't eligible. So we can't control that at this point. But we do ask our community members to wait their turn. Because we are staying focused on those that need it the most right now.
Next question is Joe Bruno, WSOC-TV.
Yeah, you kind of touched on this with Chloe's question, but you do feel Mecklenburg County is prepared for Group 4 appointments to open up? I'm hearing it could happen as soon as Monday.
Well, I think we are still working to get Group 3 done. Obviously, Group 3 hasn't been opened for long, and it is a very large group. So we're doing our best to stay focused on that right now. But we are going to do everything we can, working with our healthcare partners as well as the other vaccinators in our community to make it available to Group 4 as quickly as we can. And a lot, again, depends on vaccine. Our appointments that we have available right now are full. And the events that are scheduled over the next week or so are pretty much full as well in terms of appointments. As more vaccine comes in, we'll be able to open up further and make that available to Group 4 once the governor moves us forward with that.
And if I can just add, I know I've said this a couple of times before, but the more we can encourage individuals to, if they do have an appointment in later March and are able to get vaccinated early, if they can cancel that later appointment. This is something, again, that we are seeing and we know that our other vaccine providers are seeing. So that as appointments become canceled, then we can fill those with other eligible individuals, and that will really help with Group 4 as well.
Next question is Allison Kuznets, Charlotte Observer.
This is a question for Dr. Sullivan. Could you talk about how you're divvying up the J&J doses and thinking about what the demand could be for homebound folks? And can you also talk about for family members, companions who have been really careful about quarantining, would those people in the home also be eligible to get vaccinated at home? And what precautions will these folks have in having people enter their homes?
Yeah, so the first question about the Johnson & Johnson doses. So, we received the initial 10,000 doses last week, and we transferred 3,500 of those doses to Novant, many of which they used at their event Spectrum Center last week, and then are doing the rest in their clinics, and 6,200 to Atrium, which will be at the Johnson C. Smith event this weekend. And then we had a Johnson & Johnson event at our Medic Clinic on Tuesday. We don't know at this time, the next time that we receive Johnson & Johnson, how much that will be and how that will be allocated throughout the county. We continue to have conversations with the state about that. We're excited to get more into the community, to use it in different settings, and to make sure that it is equitably allocated throughout the community, but we just don't have those details yet. In terms of your second question, so really, at least at this time, our vaccine request form is really focused on individuals who are unable to leave to travel to a vaccine clinic. And I think at the beginning, as we evaluate demand and how this program will be rolled out, the focus should be on those specific individuals and not necessarily family members. But I think that is something that we will continue to evaluate. Any individual who will go in, our vaccine administrators that will go into the homes to administer this vaccine will follow all precautions, wearing all appropriate PPE and taking the appropriate infection control precautions when they go in to administer the vaccine.
Gibbie, this is Eric Spanberg at the Business Journal. Tonight, the Hornets will have, 500 healthcare workers, and then Saturday they will have their first general public crowd. I'm wondering if you could go through a little bit whether you've had any problems with spectator events as we've gone through this process of gradually increasing. And then secondly, do you think there's any chance that the size of the crowd would be increased as the season goes on?
Those are great questions. What we have seen in terms of events, say at some of the larger, especially the pro events, these folks have resources and have used them appropriately to make sure that they're providing very safe environments for individuals coming in, and they are being very careful to work within the guidance of the state's directives around numbers. So I'm feeling fairly comfortable with that. We have not seen in our community any issues with those type of events. The challenges that we've had is with when we start talking about college and high school events, because they do not have the resources to provide the safe environment that some of the others are able to provide. And so we're going to have to watch that closely as we move into the spring. But right now we're not concerned. I do think, and who knows, maybe even this afternoon, but probably later in the month, I think the governor is likely to continue to open things up a little bit, especially if our numbers continue to move in the direction that they're moving right now. So as that happens, I would assume that these types of athletic events will see larger numbers as we move into the spring.
Thank you.
Mm-hmm.
This is Brett again. I'm curious. I know you guys were given the stats earlier about hospitalizations down, and I know obviously the numbers, positivity rates are decreasing. Basically the entire year, it's been 1 in 20 who acquire this have been going to the hospital. Is that number decreasing as well? Is it maybe like 1 in 25 or 1 in 30, or is it still 1 in 20 who get this is still going to the hospital?
I don't know that specific metric has changed that much because we've seen a decrease. We've seen a decrease in the number of people in the hospital, but we've also seen a significant decrease in the number of people who are infected. So I don't really know that particular metric has changed that much over the year. It's been fairly consistent.
And also, I got a chance to ask Dr. Gary Little earlier this morning about the phase 4, group 4, and he bluntly said, "I wish the governor, once he sets these dates, would leave it that way, because once he changes, it just kind of puts everything in a tailspin, and they have to try and catch up and regroup." Do you have those same sentiments, that you just wish that, hey, let us take care of this group before we move on to the next group?
I will say that it presents challenges, especially every time he puts a stake in the ground and then he moves it. I understand the rationale behind that. Those individuals in this younger age group who have cancer, who have autoimmune diseases, who have chronic diseases and are at risk, have been lobbying, and rightfully so, wanting to be included in the vaccine availability. So I understand all of that. It just makes it a little challenging. But what I will tell you is that this entire year has been challenging. And if nothing else, we've had to be flexible and nimble, and we'll continue to do that as long as we need to.
Floor is open for follow-up questions.
Gibbie, just to reiterate this point, because I'm already seeing questions about it online, people with underlying health conditions will not need to prove that they have an underlying health condition, correct?
That's correct. We will not require a letter from their doctor or any kind of documentation that shows that they have diabetes or cancer or anything like that. This is going to be the honor system. And again, we're asking people to be conscientious about when they are eligible and coming in for a vaccine once they're eligible and not before.
Do we have any follow-up questions?
Gibbie, it's Allison from The Observer. Could you talk about variants and any new trends that you're seeing in the variants, any new concerns, and also how spring break activities, if we're not careful, how that could lead to maybe more virus spread if these variants are indeed more contagious than what we're dealing with before?
That is something that we continue to watch carefully. There's still not enough surveillance going on to really fully understand the variants in our community. We've had some conversations around how we might have additional options for that type of surveillance, and we'll continue to work on that. As people travel, which they have a want to do during spring break, they will be going to places where the variants are possibly more prevalent than they are here, and bringing them back with them. We'll just have to keep an eye on that. I think the main thing around spring break is we know what prevents the spread of this disease. Or this virus. And right now that's masking, social distancing, and staying out of crowds. So we just ask people, again, you can still engage in some level of travel. You can still have a good time over spring break without putting yourself and others at risk. So we just need people to continue to do that as we're working to get this vaccine out. If we all do this together next spring break, who knows, it may be back to where it was before. But again, we're still in this. We still, we are in the yellow zone in terms of the state system, which is great because we've come from red to orange to yellow. But that still means we have significant virus in our community. So people just need to be smart and use good common sense and think about not just themselves, but everybody else in our community as they decide what to do about spring break.
Gibbie, going back real quick on the aspect of herd immunity, do you think it will be until we get to herd immunity, until that is reached, that the mask mandate will remain in effect, or do you anticipate that maybe dissipating in the next month or two?
Well, I know that it has reduced and or gone away in some other states. Right now, based on what we're seeing in our community and where we are with our level of vaccination, I think that would be a huge mistake here. And I will be very vocal about that. We're not ready for that at this point. And depending on what happens with variants and what we learn about ongoing about the impact of the vaccine on the variants and those sorts of things, it's hard for me to say when masking should totally be something that we don't have to worry about anymore. So I think we just need to consider the fact that right now masking is absolutely necessary in our community anytime you go outside of your house, and leave it at that.
Hey, Paige Hopkins again. I know some folks are making multiple vaccine appointments and just jumping on whichever one they get first and not going to the latter ones. I'm wondering what's happening with those extra vaccine doses at the end of the day. How long are you able to keep them? And is that a point where anyone can just kind of come and get one that's left over?
Yeah, so I think thank you again for highlighting that challenge, and just another plea for individuals to really either only make one appointment, or if you do find an earlier appointment, to make sure you're canceling the one. First, we have started to try and account for that in some of our scheduling, and so to recognize that there may be some level of individuals who do not show up as we plan for how many vaccines we can administer during the day. And then I think, as I've said before, what we do is towards the end of the day, really start to pay attention to how many more individuals are coming in to get those doses, and draw up only that number of vaccines to really avoid drawing up a significant number that then we have to use within 6 hours once you've drawn them up. So that's something that we're able to do. And then for those very few doses that we are left with at the end of the day, we have identified individuals who usually meet the current criteria, who are eligible to receive a vaccine later on, and we will call them in to get them. We are not encouraging individuals to show up at the end of the day to look for a vaccine, because it's a small number that we have, and we have a plan in place for that.
Next question, please. Do we have any more questions today? All right, thank you, Dr. Sullivan. Thank you, Director Harris. Have a good day.
Thanks, everybody.
Thank you.